Hi, my name is Vanessa Dinsaidi, and I will be presenting my current event on mental health informatics. Imagine yourself as a mother, a sister, brother, or a husband coming home and finding your loved one hanging by a noose, having your whole world completely change, wishing what you see is nothing but a bad dream, and hoping you can go back in time to prevent their death by suicide. Not knowing what may have triggered a loved one to take their life, leaving no explanation or giving any warning signs. Losing someone from suicide is a traumatic event which has been statistically found to occur in every 15 minutes. Globally, suicide is the second leading cause of death in the world for those aged 15 to 24 years old. A recent article called Apps, Brief Interventions May Be a Lifesaver for Suicidal Teens focuses on a preliminary study showing an intervention program that includes a personalized app that functions by therapists offering various coping strategies. These methods are integrated after learning about the patient's favorite activities and fond memories. During an estimated 3-hour session, the app is individually programmed so that the teen can use the app as tools after being discharged from the hospital. In a brief scenario where parents find their children's bed sheets fashioned in a noose, the article discusses the struggles in developing strategies to help adolescents cope with recurring thoughts of suicide in the weeks after leaving the hospital. By implementing this app called Bright, this prompts them daily to rate their mood and offers personalized recovery strategies when they are distressed and decrease the likelihood of suicide attempts. Researchers found the rate of attempts in teenagers who received the personalized app was halved compared to those who received the standardized care during a hospitalization. After researchers had found within the first few weeks between leaving the hospital and receiving outpatient care, post-discharge from inpatient hospitals were high-risk times for adolescents. Equipping teens with application and encouraging the use of Bright during a crisis could be vital in saving a life. The event becomes important because it implements mobile applications that can provide technological advancements which would prevent death, increase better outcomes, provide a clear understanding of disease, treat, prevent, and mitigate risk factors related to depression among teens. The article is significant because it brings awareness to mental health issues, decreases the stigma of seeking help, and implements a plan that can be easily accessible for clients during a crisis. Incorporating mental health tools and interventions could ultimately decrease the rate of suicide deaths within teens yearly. As a nurse specializing in mental health, a primary focus that is incorporated in my profession is identifying risk factors, current triggers, and methods that can be implemented in mitigating the identified risk factors for future clients. By implementing different strategies to treat mental illness, this current event is meaningful by saving lives, providing treatment options that can offer coping skills during suicidal urges, and finding a better understanding of how to prevent suicide, which could optimistically aid victims in feeling comfortable to seeking help during stressful situations and offering effective continuity of care. Thank you for watching. Goodbye.